Hi students, I am Dr. Prashanta, Assistant Professor from the Department of Public Health Dentistry, Vinayaka Mission, Shankaracharya Dental College. Today we will be discussing about pit and fissure sealants. So these are the contents of today's presentation, starting with introductions, morphology of pit and fissures, indications, contraindications, steps in pit and fissure sealants application, about preventive resin restoration, conclusions, references. Before we go into the details of pit and fissure sealants, let us see what a pit and what a fissure is. According to Ash and Nelson, pit is defined as a small pinpoint depression located at a junction of development groups or at terminals of those groups. And a fissure is a deep cleft between adjoining cusps. Urbans had mentioned that fissure provide areas of retention of caries producing agents. Now, what is pit and fissure sealant? Simonson RJ defined as pit and fissure sealant is a material that is introduced into the occlusal pits and fissures of caries susceptible tooth, thus forming a micromechanically bonded of caries producing bacteria from their sources of nutrients. There are various morphology types of occlusal fissures. These are V type, U type, I type, IK type and inverted Y type. So what is B type pit and fissure? It is a ovoid at the top and gradually narrowing at the bottom. It is a self-cleansing and caries resistant property having, and 34% pit and fissure sealants are V type. Next is U type. It is almost same width of the top to bottom. Nearly 14% pit and fissures are U type. Next is I type, which is extremely narrow slit. Near 19% pit and fissures are I type. Next is IK type. It is usually hourglass appearance, extremely narrow slit associated with large space between at the bottom. Nearly 26% pit and fissures are IK type. Next is inverted Y type. It is bifurcation at the bottom area and nearly 7% pit and fissures are inverted Y type. Now let us see the classification of pit and fissure sealant based on the generation. First generation, UV light using, it will be near 356 nanometer and excessive absorption and incomplete polymerization at its depth. And second generation is chemically cured resins. It is accelerated catalyzed system. And the third generation is usually we will be using light cured, which is the 430 nanometer. And the fourth generation is fluoride releasing sealants. According to the filler contents, it can be classified unfilled and filled. Filler is flow is better and retention is more, and filled is more resistant to air, need to occlusal adjustment. And according to the color, it can be classified clear, which is aesthetic but difficult to detect in recall visit, and tinted and or opaque, it can be identified easily. And next is another type is colored. It is easy to see during placement and recall, and it has more retention. Based on the curing, it can be classified as autopolymerizing and light cured. Autopolymerizing having better retention and sets by the exothermic reaction, and light cured having retention near 75%. It is quick set and limitation of air bubbles. So now let us see what are the indication of pit and fissure sealants. Deep retentive pits and fissures, stains pits and fissure with minimum appearance of decalcification, many occlusal lesions, few proximal lesion, newly erupted teeth. And what is the contraindications are self-cleansing pit and fissures, open carious lesions, many proximal lesions, teeth caries free from 4 years or more, and life expectancy of tooth is limited. Next, what is the eligibility criteria for pit and fissure sealants based on age? Usually 3 to 4 years of age for the primary molar sealants application is advised, and 6 to 7 years of age for the first permanent molar is advised, and 11 to 13 years of age for the second permanent molars and premolars are advised for pit and fissure sealants. We saw the indication and contraindication of pit and fissure sealant. Let's see the main steps in pit and fissure sealants application. The main steps to be followed: step 1, isolation of tooth; step 2, tooth preparation; step 3, acid each tooth surface; step 4, rinse and dry each tooth surface; step 5, application of bonding agents, which is optional; and step 6 is apply sealant to tooth surface, explore the sealed tooth surface, then evaluate the occlusion, and the last is recall and re-evaluation. Let us see in details all steps. First we have to polish the tooth surface by using polishing cup to remove plaque and debris from the pits and fissures of the tooth. Then next we have to isolate the tooth to prevent salivary contamination, as salivary precipitation of glycoproteins onto the each surface decrease the bond strength. This can be achieved by using cotton rolls, suction or rubber dam. Next is acid etching. It can be done by using 37% orthophosphoric acid for 20 to 30 seconds, then rinsing and drying. Fully rinse approximately near 30 seconds and dry the tooth. We should check the effectiveness of each agent by drying the air, which surface should be appear chalky white. So this will help us to find out the effectiveness of each and to evaluate. And next is sealant application. Apply the materials of fissure and allow it to flow, then cure the material for 30 seconds. Then evaluation of the occlusion. It can be done by using articulating paper, unfilled resin sealant, cement or material should be abraded, and filled resin sealant occlusal adjustment is must to be avoided to discomfort. Periodic maintenance is very important to evaluate any loss of material, exposure of voids, any caries development, and recall visit every 6 months. So in this slide you can see the image of a tooth with deep pit and fissure, and the second image of tooth where pit and fissure sealant is applied. There are some recent advancement in pit and fissure sealants. Nowadays lasers are using for curing due to reduction in setting time, control of specific radiation, energy wavelengths, and control of area of exposure. Another type is fluoride releasing sealant. Addition of fluoride have additional caries protection effect. And another type is wet bond sealant. It bonds chemically and micromechanically to the moist tooth surface. It is the first pit and fissure resin sealant that can be applied in the moist field also. Next, coming to the preventive resin restoration. It is a natural extension of the use of occlusal sealants. It integrates the preventive approach of the sealant therapy for caries susceptible pit and fissure with the therapeutic restoration of incipient caries with composite or glass ionomer that occur on the same occlusal surface. PRR is a conservative answer to the conventional extension of prevention. This extension prevents future caries formation but does so at the expense of losing substantial healthy tooth structure. The PRR preserves the sound tooth structure. There is a types of preventive resin restoration. 3 types of preventive resin restoration based on the extent and depth of the carious lesion, classified as type A, type B, type C, which was given by Simonsen. Type A, suspicious pits and fissures where caries removal is limited to enamel, and type B, incipient lesion in the dentine that is small and confined, and type C, greater exploratory preparation in dentine. We have to note that only type C needs administration of LA and liner placement over the exposed dentine. Type A restoration, what are the procedure? It is similar like pit and fissure sealant, minor changes. First you have to clean the surface, then isolate, remove decalcified pit and fissure with a burr, acid etch the tooth surface and then wash, apply the sealants, then polymerize and check the occlusions. Next is type B restoration. Exploratory removal of caries has included dentine to a slides. Procedure for type B pit and fissure sealants or preventive restoration: removal of caries, liner placement, acid etching, apply bonding agent, fill with composite resin and polymerize. Sealant placement on the fissure, polymerize, check the occlusion. Coming to the conclusion, the placement of pit and fissure sealants prevent food lodgement in the highly vulnerable surface of the tooth and thereby prevent dental caries. Sealants are easy to apply, but the application of sealants is extremely technique sensitive procedure. Parents are often unaware of the existence of dental sealants and hence educating them is very important. These are my references. These are the important question. For 10 marks they may give steps in pit and fissure sealants, or for 5 marks indication, contraindication of pit and fissure sealants. Thank you so much.